Glenn, thank you very much. Thanks for organizing this and for asking me to say a few words to kick us off. First, I just want to congratulate you on doing such an incredible job with this Center for Global Health that has coalesced a community that existed here at Penn and has grown. And you've provided a home and organization and strategic vision for us that has just been so impactful. And from the institution, I want to really thank you for those efforts. And it's hard to think of somebody who over a career has contributed more to our community in many different roles. And then to take this on after being Chief Scientific Officer for many years, it's just remarkable impact. So a round of applause for Glen Gaulton. You know, over the last several decades, I think Penn has been on a remarkable ascent. It's appropriate to be here in the Rubenstein Auditorium when I think back a couple of decades ago when Arthur Rubenstein became the dean and took on as a strategic imperative what was at the time all the talk of the town and in Congress, the Valley of Death, where there was a lot of money going into medical research in the country, but apparently, not enough good drugs coming out the other side. And we took that on better than anybody, and we've become really the world's leader in generating innovative new therapies. But I think remaining before us remains a huge challenge, which is applying medicines that we know work and treatments that we know work to the people in need in our community and around the world. And I like to sort of think of that as crossing the sea of sorrows. And I think this community attacks that problem better than any and deserves enormous recognition and thanks for the work you do. And I think we all agree there's a lot more work left to be done. But to me, this remains the challenge in front of us without giving up on the importance of developing great new therapies. Otherwise, we don't have the therapies to distribute around the world. But we have to make those therapies affordable, and we have to make them in ways that they can affect people in the community and around the world as effectively and as quickly as possible. So I look forward to hearing the discussions today, and in particular, it's a personal joy to welcome Jim Kim here today. Jim and I trained together, and I've known him for many years, followed his stellar career, and we'll very much look forward to his comments today as well.
Thank you, John. Well, we have a busy day, and I know folks are, will most likely be going back and forth because we all have day jobs, and so I appreciate that and be comfortable with that. Very quickly, I'm just going to spend a few moments to go over the agenda, and then I'll launch into a little bit of an overview of the Center for Global Health very quickly and what we're all about. So the day, you've all got the booklet, hopefully. We're going to begin with my overview of the center quickly. We're then going to enter one of three series of what we call lightning talks. We have a lot of people working in a lot of places. We want to expose you to as many of them as possible. So we've asked the speakers to give very short 5-minute talks. So there'll be no questions at the end of those. If you have questions for folks, that's what the break is for. That's what the lunch is for. That's what the get-together session at the end of the day is for. But in this way, we're going to have 30 people speaking throughout the day, little short vignettes, because we're all over the places, as you know, and if you don't, you'll see in a minute. After the first round of lightning talks, we'll have a bit of a break, and then Dr. Kim's keynote speech. And again, thank you, Jim, for coming. Particularly appropriate on the 10th anniversary of the Center for Global Health. We were really launched in the beginning by his dear colleague and our friend Paul Farmer some 10 years ago. So this is a fitting, a fitting closure to at least our first, hopefully of many, many decades in, global health. We'll have lunch after Jim's talk, and then 2 more rounds of lightning talks. That'll take us to, mid-afternoon, at which point most of you can come out and go to, a networking session outside. Jim and I, for the junior faculty and trainees, are going to hold a little bit of a career workshop, time permitting. We're going to see how the day goes. Okay, and then at the end, we'll stay open. I want to remember to tell you at lunch and at the breaks, we have posters out there. They're going to be judged. So please take time to go to see the posters as well. Okay, so with that, the Center for Global Health. And when we thought about the center from the very beginning and what the vision of the center should be, it's really pretty simple, a healthy world. And it's a great vision statement, I think, because it's simple, it's straightforward, and it can mean all kinds of things, because we know everywhere in the world, including our country, there are gaps in providing access, care, follow through, et cetera, for all of us who at some point are going to deal with these problems if we haven't already. And in many, many parts of the world, things are so desperately bad that even little things that we might do can be hugely, hugely impactful. So, one of the first things that struck me in the beginning was just this, because quite honestly, I didn't really come from a background in global health. I did some HIV work, we got samples from sub-Saharan Africa, but I'd never even been. And so when we started thinking about the center and what it could be, I spent a lot of time going around talking to everyone. What are we doing? What can we accomplish? What have we? What can we? Really, what do we want to be? And the thing that struck me the most was, frankly, thank you, John, for your comments, but this is about all of you, really, not about me. The amazing people and the passion that you all have. And the key is, how do you marry that passion with strategy? And that, to be blunt, for the most part, there are exceptions, but for the most part, that's what was absent before the center was there. You were all doing your great things, 1,000 flowers blooming. But how do you pick the ones to fertilize so that even greater impact can happen? And that, in a large measure, is what the center is about. So where are we now, 10 years later? 87 countries we work in, 162 defined, funded projects, 113 scholars within the center, many hundreds of other people engaged with the center. Every year, roughly 80-ish of our trainees are going abroad, often to Botswana, or sort of our linchpin location for that, but all over the world, back and forth. And you can go to our website, very easy, CGH, Penn. Usually you can just put in CGH and it pops right up on the website. You can click on a country. You can click on a person. You can click on a discipline area. And then these kinds of things will come up, these for some of our colleagues in Botswana, and you can click on them and find out what they're doing, and I encourage you to do this and talk to people. These are linked to 28 bi-directional partnerships, and the bi-directionality is intentional. We get approached all the time. We would like to work with you. Well, how is this exchange going to be both ways? Because in order to sustain these relationships, there really needs to be benefit to both parties. And so we focus a lot on that. And because of that, every year, while 80 roughly of our trainees are going abroad, more trainees and colleagues from other institutions are coming here to spend a little bit of time at Penn. And when I say Penn, our Penn and CHOP. I'm just going to be saying Penn, but of course our colleagues at Children's Hospital, hugely, hugely important in this space. And probably enough said about that, right? But what about a center? I mean, all of you are just working your tails off. I've been faculty for a little over 40 years at the institution. I know how hard everyone is working. Centers need to bring something more than just organization. And so one of the things we've done, and I'll speak about this in the next couple slides, is that the center has brought to the table center-led projects that bring people together that are on top of what all of you are doing. And that has actually garnered $63 million in this time to help support our efforts where maybe we don't have money and we need seed funding. Because quite frankly, if I'm always going back to the dean and asking for money, that's taking money away from something else at our institution. It's moving money around. It's not adding to the equation. And this does. So this has been a huge plus for us. So what's the strategy? I like to think of this as the 3 Ps. People, places, and programs. So everyone works somewhere. a place, the first P. And what we've done is take where all of you were working and put that into essentially a regional strategy in that location. So we think, for example, about the largest location that we work in sub-Saharan Africa, and how do we coalesce the historical activities that have gone on in Botswana with emerging work in Ghana, where we're doing increasing amounts, in Tanzania and Malawi, where we had colleagues outside of the School of Medicine with longitudinal projects. How do we bring all that together and think of new things we can do, but to frankly be more impactful in what we do so that we can help our colleagues even more in what they want to achieve and accomplish. And so we've done that in sub-Saharan Africa, Southeast Asia. You'll hear later on about our work in Vietnam. That's one of the keystones of this. I'll say something later. One of the few times I've worn a tie, right there. In the Middle East, the new program, we're starting there. Latin America, we have a lot of ongoing activities. And of course, we also do a lot here in our home country, particularly in the Indian Health Service. So there's a lot of passion. Some of you work in these locations because this is your heritage. You have longitudinal relationships there, maybe because of your training, et cetera. We want to build on that and put strategy again with passion. Everybody works on something, a program. So people, places, programs. There are classical disciplines that guide many of our global work. Many of our departments have pre-existing the center, have organized efforts. The Department of Pediatrics, and I mentioned this, so when we say pediatrics, of course we mean CHOP, incredibly well organized programs in global health that preceded the formation of the Center for Global Health, so kudos to them. The Department of Medicine, and I know Carol McLaughlin's here, the Chair of Medicine, Mike Parmacek is here, tremendous training programs and nurturing programs, and huge numbers of faculty working in this space, and on with both our clinical and our basic departments. But we've got 28 departments in the School of Medicine. So we wanted to broaden this out, and so working with many of the departments, and you'll hear about this throughout the day, we've increased efforts in emergency medicine, neurology. I won't read the whole list because you'll hear from the people about this in the day, about how to nurture colleagues in this area and how to build impactful research and implementation projects in the space that typically surrounds a clinical discipline like cancer, for example. But then we also have many emerging domains. Oh, and I should say, so here's emergency medicine. There's Megan. Megan will be talking. Here's Ruth Waldemeier, a fellow we're supporting in obstetrics and gynecology, working on a OB project with MSF in Mexico. Here's Farouk, our Botswana director now, led case competitions. Farouk and Harry in the Department of Radiology imagined this venue of creating virtual case competitions. We've had almost 4,000 individuals from around the world who have dialed in either the programs in radiology or now emergency medicine and obstetrics and gynecology. So it's been absolutely tremendous what people do. But there are emerging areas that cross departmental boundaries that we want to make sure that we work together on. And examples include medical education, our biggest area of work, clinical training, medical education. How do we coalesce those things into organized efforts? And you'll hear about that. Cancer, oncology, an enormous and growing world problem, spanning many, many departments. How do we bring them all together? So last year we formed the Center for Global Oncology, which rests as a center within the Center for Global Health. And so Larry Schulman will talk about that a little. Larry and Surbi Grover co-lead that effort. Disaster relief, something we didn't do much about before because it's very difficult for an academic institution to have boots on the ground to support growing efforts. You'll hear about some of our work in Ukraine, which began in the second month of the war, sadly continues to this day, and I literally mean this day, because every morning at 5, 6 a.m., we're talking to colleagues in Ukraine, and we go on site now 3, 4 times a year to help them with the horrible blast wounds that are occurring, AI and imaging, et cetera, et cetera, et cetera. So we've helped support existing programs and build and round out other programs. And people. It doesn't matter what plans you have. If I've learned anything in 40 years, you can have the best plan in the world. If you don't have great people, not going to work. Reciprocally, If you've got great people, quite honestly, they'll figure it out. Ideally, you have both of those things together. A wonderful plan, incredible people, and then you're off to the races. So what does the Center of Global Health really do, and what are we about? It's about building a home so that when we're abroad, we don't just think, oh, I'm in global health and I'm embraced here, but when I come back to Penn or CHOP, I kind of feel like nobody knows what I'm doing and I'm alone. We now have a home. Opportunities for ongoing engagement, you'll hear about these throughout the day. New program development, I just spoke about that. More and more defined and beneficial, both for our partners and us, bidirectional partnerships. We often provide seed funding for these efforts. We've helped departments co-recruit more faculty into the global space and help retain some of our faculty. So we keep building the cadre of individuals in this domain. Career mentorship pathways, logistical and legal support, this together with our colleagues at Penn Global, based in the university in the provost office, and unifying events like today to bring people together, and we do many of these throughout the year. So that's all I really wanted to say, just a quick overview of the center so you could appreciate how we think about things and what we're all about. And in the bottom line, it's about supporting you and helping you so that the benefits that you have with our colleagues around the world can be amplified even more so than what you might do on your own. So thanks.